Good afternoon, everyone, and welcome to the Miller Center webinar series. And today we are really blessed to have two terrific experts on looking at the coronavirus crisis through the lens of China and the US-China relations and the geopolitics that surround it. On New Year's Day, as we entered a presidential election year, there was one thing on both political parties seemed to agree, which is that China had become a full-on rival and adversary. 2 decades of cooperation and integration marked by China's accession to the WTO, among other things, had led to a growing trade war and a decoupling of the relationship in recent years. The day before New Year's Eve, US officials began to worry about a virus outbreak in an inland province in China that few Americans had ever considered. We now have America's biggest crisis, arguably since the Cold War. And this is China's, in fact, perhaps even bigger, and this is China's first crisis as a global power. And that's not because the crisis started there. If it had started in Laos, it would not have made Laos a global power, but it's because it happened in China that everyone expected serious economic reverberations, and because of China's global contacts, the virus spread quickly. 3 months later, after nearly shutting down its entire 1.3 billion people, China has begun to return to normal, claiming the number of new COVID-19 cases to be nearing zero. Apple has reopened its stores all across China, and Starbucks is in the process of doing the same, including the inaugural reopening of its virus at the virus's epicenter, Wuhan. The numbers coming out of China, however, have been met with intense scrutiny from the United States government. Meanwhile, President Trump and his staff, after weeks of delay, began referring to COVID-19 as the Wuhan virus or the China virus interchangeably. Since then, they have toned down that rhetoric and now are accepting resources in the form of unused PPE from the Chinese government. This comes after Presidents Trump and Xi Jinping agreed to détente last Thursday for COVID-19 matters. But the implications go far beyond the name calling and protective equipment. The implications speak more generally to the future of US-China relations as the essential two countries in the world. And we are broadcasting to you today via Zoom, a company founded by a Chinese immigrant in Silicon Valley and whose software was developed on both sides of the Pacific. It's a technology, however, whose security itself has been called into question. I'm using an Apple computer and monitor, which is famously designed in America and manufactured all across the globe, with considerable parts and assembly happening in China. So here to help us understand all of this, and in particular the Chinese-American relations and the geopolitics of COVID-19, are two fabulous experts at UVA, Aynne Kokas and Brantly Womack. Let me start with Brantly, who is an expert on all things China and currently holds the Miller Center C.K. Yen Chair, as well as a professorship of foreign affairs here at the University of Virginia. He is the author of several books and countless articles and book chapters. Brantly has been a Fulbright scholar and now holds an honorary posts at Jilin University, East China Normal University, and the Zhongshan Sun Yat-sen University. In 2011, he was recognized with the China Friendship Award for his work with Chinese universities. Aynne Kokas is an expert in US-China relations, cybersecurity, and the media industry. She is an assistant professor of media studies here at the University of Virginia, a faculty senior fellow at the Miller Center, a Kluge fellow at the Library of Congress, a term member of the Council of Foreign Relations, and a fellow in the National Committee of US-China Relations Public Intellectuals Program. Anne is widely published, including her book, Hollywood Made in China, 2017, detailing the power of the Chinese market has over US commercial media industry. So we're lucky not just to have Anne with us today, but to have her part of the Miller Center family. We've got a lot of ground to cover, including taking questions from you all out there. Please send them in through the Q&A function, and I will turn to them and incorporate them in the conversation. Let me start with, since we study the presidency here at the Miller Center, let me start with leadership in both countries. Xi Jinping and President Trump both have been touted as strongmen. And yet they've had very different internal reactions to the crisis. So just as a general opener to Brantly and Aynne, how would you assess both presidents, and in particular, since you're studying China, What is the current take on Xi Jinping, how he responded initially, what his more recent responses have been, and how you see him managing things internally in China? And then we can come back to the international side.
Well, first of all, I think we should recognize two important events today before we get started with our questions. One of them is World Health Day, and I hope everybody in the audience is staying healthy and that we'll keep healthy. That's the most important place to begin. And the second thing is that today is the first day that China has not found a new case of death, a new death from coronavirus. And of course, we'll be talking about statistics later on, and statistics have problems of lying with and lying about statistics. So we'll be getting to that. But as far as the questions of our leaders of both countries, I think there's some similarities of situation between them. And one of the similarities is that both leaders' behavior before the crisis created some problems. For Xi Jinping, his emphasis on top-down control led to greater caution and a sense that the center was watching for mistakes, not for new information. And I think that really did hurt the Chinese initial response. Those people in Wuhan didn't want to be the first people to raise a new problem for Xi Jinping. So that really lengthened the synapses of the Chinese system. And on President Trump's side, there's been this buildup of China as hostile competitor approach that has frozen the relationship. And you have trade war, but more than just trade war, you have China described as a revisionist power that's after our basic values and after our position in the world. And so you have this frigidity of relationship to which both have contributed. So that's for the background. And then the initial stages in both countries, both leaders had problems. In Xi Jinping's case, he didn't visit Wuhan for quite a while. And people resented the lack of information in China, lack of official information, and the lack of and the crackdown on private information. And so the first spread of the virus, say from January through February, I would say Xi Jinping's reputation in China went down. Similarly, in the United States, you have President Trump. Given his relative distance from practical governance matters, he pretty much ignored the coronavirus, except for some good but fairly isolated actions like cutting down on traffic from China. Basically, he has a lot of that slow response that I think Aynne has some really good details on, that really has cost our preparedness. Now, what happens going forward? Well, as both countries are more involved now in coping with the virus, that is something that strengthens the image and the just felt need for strong leadership. And so Trump's poll numbers go up, and I'm sure that the moral equivalent of poll numbers in China are going up for Xi Jinping right now.
So looking at this from a media standpoint, oh, sorry, is that?
Okay, I was calling on you.
So looking at this from a media standpoint, I think that we can see a lot of disturbing and shocking parallels between how Trump and Xi have misdirected the media landscape. Within the Chinese context, one thing that was in some ways a happy coincidence for a strongman leadership like Xi Jinping's is the fact that we actually saw in the beginning of introduced in December and then taking effect on March 1st was a stronger internet regulation law that allows for greater crackdown on the sharing of information. And we saw as early as mid-December of 2019, cracking down online with terms like Wuhan and Wuhan seafood market. So within the Chinese context, we've seen a rapid clampdown on the overall media landscape. Now, the interesting thing is that this operates in many ways in parallel to what we're seeing in the US with a lot of media misdirection. So, for example, the discussions about whether or not we should be using masks or not, referring to the virus as the China virus or the Wuhan virus, it distracts from the larger question of preparedness on the part of the US government, and whether or not the federal response has been sufficient. And so what we're seeing is actually in some ways a parallel leveraging of media. In China's case, the control and the shutting down of larger media outlets, and then in the US case, we're seeing a misdirection of media attention and media focus as a way in both cases to distract from a weak response, particularly in the beginning. In the US, we actually aren't necessarily seeing the type of strong ramping up of a response that we're seeing in China, and I guess we can hope for more of that in the weeks to come. But the one thing that's really interesting to compare and contrast about the U.S.-China case is the fact that within the U.S. context, the states have a lot more autonomy to actually respond to this, and our media does have the ability to push back and critique. However, people in my department, colleagues like Siva Vaidyanathan and others, have critiqued the ways in which the virus has been covered in the US as a way to actually give cover to President Trump.
I'd love for you to both tell me a little bit more about what you're hearing about how the virus is being covered within China and being reported. It is fascinating to watch the numbers and see comparatively how little it's spread across the country, how they were able to keep it within Wuhan. What do you know about that, both as a management matter and as a communications matter? What did people in the other provinces know about the outbreak?
Well, so there was, Brantly, go ahead.
Oh, go ahead, Anne.
Oh, so one thing that was, so there was a relatively slow rollout of information about the virus. We saw that the Dr. Li Wenliang was removed from his position, and he and his colleagues were arrested. So there was a very clear kind of official response to limit the actual access to information about the virus. But what's been really interesting, in addition to the ways in which the Chinese internet landscape has allowed for the tamping down of information to spread about the virus, is the ways in which existing technology and media surveillance has actually facilitated methods for preventing the movement of the virus. So we saw Alibaba and the WeChat platform actually create a system through which monitored people's movements and their potential vulnerability, and allowed the government to have a system through using mobile phones to actually prevent the movement of individuals who might be high risk. So in some ways, the larger surveillance technology landscape that has been evolving in China over the past 10 years really came in handy as a public health intervention. And it actually offers a good argument for why those interventions why that surveillance is useful and provides a potential valuable governance tool that the leadership can then use to sell to citizens as a means for that privacy invasion.
And let me add something sort of beyond and beneath the media on this that I think is very important and hard to really realize in the United States. And that is that a huge amount of what people really trust in information is coming through rumor and social media, because official media is official media, and official media has to be approved, and it takes time, and people are sophisticated in China about dealing with official media, just like we here are sophisticated in dealing with advertising. You don't believe every advertisement that you see, and Chinese don't believe everything that they hear there. But so what do they do for information that counts, like their health? They depend on what their neighbors think. They depend on what people in authority that they depend on their sources of inside information, especially those would be rumors, and then they depend on broadcast rumors essentially in social media, and those can be misleading, but they also help fuel a kind of local mobilization, so that a apartment building or a group of neighborhoods will get together and they will organize their local system of surveillance, and they will note if somebody drives in the neighborhood with a Hubei license plate, and they will sound the alert about that. And so it's more complicated than watching the TV news. Information that counts is information that that you get from reliable sources, and official sources are not necessarily unreliable, but they're late and they're general.
You touched on something pretty interesting there, Brantly. The idea of seeing a license plate from another state. In the United States, we've seen some very interesting interstate conflicts. A Democratic governor in Rhode Island not wanting New Yorkers from a nearby Democratic state coming in and vice versa, but also a Republican governor in Florida only letting Florida residents get off a ship and telling residents of other states to go find a port someplace else. Tell us a little bit about that, to the extent that you know it in China, the extent to which other provinces view this as a Wuhan problem and not, we don't do that in Chengdu or Chongqing or in Guangdong. It's in other cities and provinces. Not our problem. Take it and keep it there.
Well, I would say we don't want it to become our problem, is a better way to phrase it. They see that it's very vivid what's happening in Hubei or people in Wuhan to people in Sichuan, and they don't want it to happen there. So the first thing they do is wall out Wuhan. They look for those license plates. And I was in China during the SARS epidemic, and you could not travel from one province to another. I was in Shanghai. If I had crossed the border, me and my driver would have spent 14 days in quarantine. Absolutely. Not a question of temperature or symptoms or anything like that, but just the walls go up. China's famous for great walls. It has a lot of little walls that can go up very fast.
And are you seeing that internally? Is there a Wuhan phobia or a Hubei phobia in other provinces that you're seeing on social media or other things?
Yeah, absolutely. In fact, there are some of the kind of most moving missives on social media are from citizens of Wuhan talking about how they're being discriminated against in Shanghai and in Hong Kong, and these peons to special moments or special items in Wuhan, like the hot dry noodles, which are the local specialty, and they'll say we're just people who love our hot dry noodles and we're just trying to live with our families. And it's really, so there's a lot of effort to humanize the people of Wuhan. And there's also been some of the leading voices in terms of just talking about what it's like to be in confinement. Like personally here in the US, I was reading blogs by people in Wuhan about what they did and how they prepared for shelter in place. Those were some of the most useful tools that I had as I was getting ready for this. One thing, I really appreciate that sharing of information. But one thing that has been interesting is also reading about people in Shanghai and in Shenzhen and in Guangzhou talking about how the reason that those cities haven't had outbreaks that were as bad as Wuhan was because of the kind of superior governance in those places. So we are seeing this jostling between different provinces, asserting that one place is better, more well run than another, and therefore their virus outbreak wasn't as bad. And obviously that's very difficult to externally verify, but things haven't gotten as out of hand in Shanghai as in Wuhan. So that will be something that we can try to assess its veracity of much later. But it is interesting to start to see the same kind of tensions. in addition to Rhode Island and New York, we also saw Kentucky and Tennessee, the Kentucky governor saying, don't cross the border to Tennessee because we don't know what's going to happen if you go. So, I mean, there are these really interesting parallels in terms of the provincial and state relations.
Focusing a little bit now on from the inside out, as it were, Wuhan is sort of the Ohio of China, right? It's a central industrial province. It's in the middle of the country. China has gone through this journey that I alluded to at the beginning of being a very insular and protected country to having embraced globalization over the last 20 years, but then also having its own bouts with globalization. And I'm just curious to hear you both reflect on how the Chinese, both the government and the people, view this moment as a moment about globalization. They have become, both as a result of the disease and, say, President Trump and others' rhetoric, somewhat stigmatized internationally as a result of this. And yet they also have been leaning into the crisis in some ways and trying to be helpful internationally. And I'm just curious, will this affect Chinese views of the world going forward?
That's a great question, Bill. I think it can go in two directions. One of them is that, how did China view the rest of the world in the time that the virus was increasing in China? I would say that basically the rest of the world, including University of Virginia, showed its sympathy with China. And that was very important to China, and it helped cause some resonance with this sense of we're all in this together, even though it's starting here first. But what will happen when you get into the current stage where China's relatively free and the new infections in China and Singapore and Taiwan are coming from first Europe and pretty soon the US? Will that cause new walls to go up of that sort? I would expect yes, because the walls make sense in the sense of not wanting to go back to the situation of new hotspots. The other thing, though, is that China's reputation, of course, went down and deservedly down as the origin of this worldwide problem. It's may not want to call it the China virus, but that's where it became a pandemic. Now, however, as everyone's in the second phase, the second grand phase of dealing with the virus, the phase of coping with it, not the phase of preventing its spread, but coping with it and moving to solutions, then China's in the lead because it's had the most experience, and it has the global contacts that led to the virus spreading are also global contacts that make possible China aiding over 80 countries in providing medical resources and aid in providing experience, sharing experience with medical personnel elsewhere and things of that sort. So China may put up some walls against people coming from now hotspot countries, but at the same time, it's a leader in recovery. And that's a point of hope to other countries and also useful experience.
So my understanding is that at this point, we actually don't have, China is not allowing non-Chinese nationals into the country unless they get a new visa, which presumably will be much more challenging to get and much more rigorously enforced. So we're already seeing that. And then there's the 14-day quarantine. So anyone who enters, whether they're a Chinese national or not, has to have a 14-day quarantine in order to not introduce new infections into the country. So when we were talking earlier about the number of infections and whether or not we can trust those numbers, one thing that's really interesting is that there's been a reclassification of foreign cases coming in versus local cases. And I think this kind of speaks to that skepticism of the rest of the world. as a potential vector for disease, even if the disease initially started in China. The other thing that I think is really interesting, though, is on one hand, we see this tightening up of borders from a public health standpoint, as well as the soft power move to offer masks and offer PPE to other countries, which, I mean, I call it a soft power move, but it's also an amazing humanitarian gesture, for which we're very grateful. So it's, but one thing that is really interesting is I think we may see a tightening of outbound capital investment from China as well. So that kind of conservative view of people coming in, as well as limitations on the amount of capital going out because of the severe economic impact it has had on the country. So we may see a tightening up of some of those earlier BRI investments, or kind of guidance to U.S. company or to Chinese companies about their foreign investments, which we've seen in previous periods of financial crisis.
I want to come back to the BRI, the Belton Road Initiative, in a second. But Anne, I did want you to reflect a little bit for everyone about your own personal experience in trying to engage with China on some of these actual humanitarian issues. You study the media and you study China broadly, but you've had a very local, personal engagement that I think is worth sharing.
Yeah. So my job is I would focus on U.S.-China media and technology relations here at UVA, and as a result of that, I've been working closely with people in China who do trade relations. So people from the Chinese Central Committee for the Promotion of International Trade, another organization called APCEO, which works in different provinces. And what's been very strange over the past few weeks is my husband is actually an oncologist here in Virginia, and they haven't had enough personal protective equipment. A lot of the discussion has been about ER doctors and people who are intubating and extubating, and that's very important. However, there are a whole other range of people in the medical system who are immunosuppressed, like cancer patients, and they and their doctors don't have enough PPE either, and are much more vulnerable to the effects of COVID-19. So what I've actually been doing is working with my research interlocutors to try to find reliable suppliers for N95 masks. And one of the things that's been really interesting was the amount of support and care that I received from my research interlocutors as I was going through that process, trying to help direct me to reliable suppliers to make sure that I didn't get ripped off, or that, I didn't, that I was able to get, good masks to care for my family. And at the same time that this was all happening, the FDA was not allowing Chinese standard masks into the US. So China has a different standard than the US does for the creation of personal protective equipment. So rather than N95 that we use here, China has a KN95 standard. The FDA was critical of the KN95 standard, even though it's actually been central to China's effective disease response, and wasn't, starting May 28th, wasn't allowing any KN95 masks in. They were getting stuck at customs, and those were the masks that were available to import for medical providers here. So following the Xi-Trump détente, there was an opening, and now technically we are officially supposed to be able to be receiving those KN95 masks, but it's really hard to know. But what's the really frustrating thing is, as the spouse of a healthcare provider, is seeing the US-China trade war and debates about technical standards, which, I'm very familiar with in my work in, looking at 5G and different media and technology, different technology platforms actually impact the US response to this crisis. So that's a very kind of frustrating moment. And I think that this is an important moment to take a pause in the trade tensions and really just focus on the needs of people and people and those who are suffering.
I want to come now back to, thank you, Anne, for that. I want to come back to the Belton Road Initiative. We did a conference on this at the Miller Center back in the fall of last year, and have touched on it a number of different times. This is China's global effort to, if I remember correctly, the belt is actually rail routes and overland routes, and the road is actually the sea routes, or maybe I have that backwards, but it's essentially an infrastructure set of global connections that China was making, both investing in its own infrastructure, but also infrastructure around the world to facilitate Chinese trade and investment. And this goes to one of the questions we've already received from our audience, which is, do you think China's economic future is in question as a result of COVID-19? Does this offer the possibility for Chinese Communist Party to offer slight reforms? And there's two dimensions of that, right? One is internal. How much are they going to open up their economy internally? But also internationally, will they still be bankrolling on a future based on globalization when that now might be called into question, both as a result of xenophobia brought about China, but also whether or not China can rely on international partners?
Well, certainly the global impacts of the virus and the impacts on every country are something that will be severe and will have some lasting effects as well as correctable effects whenever the main pandemic is over. As far as China's own economy is concerned and its relationship to its big external investment move of the Belton Road Initiative, the economy certainly has gone negative first quarter. I think it'll probably recover to positive over the next 3 months, and on the assumption that not that it will hold to the virus being over in China, because one problem with having low infection rates in those other provinces is you have the potential of those provinces becoming later hotspots, which is one reason you have things like the 14-day quarantine and other types of controls on incoming people. But it's likely it's already trying to start the recovery process. Europe is too, a little bit, but everybody's going to be cautious. And so it's going to be a slow recovery. Then the question is, how does China prioritize the investments that it does? Well, the first one thing is bailout prioritization. That'll be important in the US too, it already is. And the second thing will be domestic continuity of projects. But the Belton Road, the major projects of the Belton Road Initiative, this is not only close to Xi Jinping's heart, this is close to its attempt to have an improving dynamic in its relationship to its neighbors. And it knows that its neighbors are hurting as bad as it is, if not worse right now. And they need the infrastructure investment too. So I don't think you're going to have a reversal. You'll have a slowing down of Belt and Road Initiative, but you're not likely to have now we're going China first and nothing leaves the country until we're all happy. I don't think that's going to be Xi Jinping's attitude.
Your own thoughts on the on Belton Road? Have you followed that closely, and particularly in this context, the extent to which China still feels confidence in the places that they're investing in internationally, especially in the developing world, where we're only seeing the first stages of the spread of the pandemic?
Yeah, I think that there are kind of multiple ways that this will be impacted. On one hand, there's the actual availability of capital. So how much capital do Chinese firms that are kind of leading the Belt and Road charge have available given the economic slowdown? And how willing are they to look at other developed markets? But I think that you're absolutely right that in the developing world, we're just seeing the very beginnings of this. So in Romania, which isn't even a developing country, but a kind of poor European country, the guidance to where China actually has growing investments in 5G or in broadband infrastructure, as well as trade. The guidance for anyone over 65 is currently to stay inside for the next year and a half, because they don't have enough capacity to, even with ventilators or with protective equipment. I mean, the challenges that the US is facing are nothing compared to what we're seeing. And that's a comparatively prosperous country. When we look at other countries in Latin America or in Africa, this becomes a much more challenging issue. And that's where a lot of the Belton Road investment is. So I think that there will be a lot of skepticism about continuing projects in those areas, particularly those projects that require a lot of travel between China, China and Ethiopia, China and Kenya. Those are countries where there's no medical infrastructure those are already overstretched systems to begin with. And I'm very skeptical that those investments will continue at the same pace that they are. As a public health matter as well as an economic matter.
Mm-hmm. I'd like to shift back to something that we touched on briefly before about Chinese statistics. And I should preface this question by saying, in the United States, we're wrestling with statistical challenges, mostly that have to do with detection of the disease and testing. So this is not to say that anybody's perfect in this regard, and yet there has been a lot of skepticism about a Chinese truth-telling. I think it actually, let me touch on three different things and get your reactions to any of them. One is their reporting, which Brantly touched on today, about no new cases and no deaths. Do we think that the Chinese numbers for actual cases and deaths tracks? The second is the sharing of broader Chinese information. One of the elements of a recent Washington Post story that laid out the first 70 days within the Trump administration was that the Trump administration, CDC officials in particular, were trying to get information about the crisis from China, and they just put up a wall and weren't sharing information. And then the third, and I'm really going to look at Anne's little square here on this one, is Chinese information and disinformation about the crisis, not just about internal truth-telling, but where the crisis came from, how it has been spreading and moving elsewhere.
Anne, why don't you start?
Yeah, so it is a really significant question about how much we can rely on these numbers, and how reliable this information is. There's an excellent scholar at Cornell named Jeremy Wallace who's done a lot of work on the reliability of Chinese statistics, and he's written some recent things in the Washington Post as well. But I think that I alluded earlier to this reclassification of cases that has been that was reported by Caixin, the Chinese media agency, that really focuses on the fact that the ways in which this crisis is being counted have been a moving target. So whether or not it's a local case, whether or not it's an asymptomatic case, and asymptomatic cases being counted separately as other cases. The other question is, what constitutes something being asymptomatic? Is it something that doesn't require hospitalization? Is it something where someone has been tested and they have absolutely no symptoms? And then what happens with those asymptomatic cases? So I think that there's a lot of uncertainty as it relates to counting. One thing, though, that I think is important to note is that the rough estimates of the number of people who have been dying and the numbers of people who have been tested are comparatively reliable. So there have been some estimates that the death toll in China is 10 times what is actually stated. I think that's kind of overstating the case. There are, from my reading of it, there are differences at the edges, and there probably is relatively significant undercounting, but not on the order of magnitude of double or triple or quadruple. So I think that's an important thing to note, that we are dealing with unreliable numbers, but also it's there's not as a massive conspiracy as you might be reading on the internet. Mm-hmm. The other thing that I think is important to note is that this is a very difficult problem to get numbers about anywhere. So for example, in the US, people who are being tested, the numbers that we're getting right now for cases, at least in this region, are from people who were tested like 8 to 10 days ago. So our numbers are not reliable. And the only people who are being tested right now are people who are hospitalized or who have very severe symptoms. So whereas China's reporting the asymptomatic cases separately, the US isn't reporting asymptomatic cases at all because we don't have the capacity to test for them.
Right.
So I think that's an important thing to note and to balance. And I'm happy to talk about disinformation, but I want to give Brantly the chance to talk about numbers and add his perspective on that as well.
Oh, very good, Anne. And two things I draw from your response. It's that there's two different issues involved. One of them is the initial issue of statistic and reporting and information. And that certainly is problematic. There's information suppression by the local officials, first of all, then national not releasing to official information, and then question of dealing with our Center for Disease Control. Of course, now that was problematic because the Trump administration gutted the budget of the Center for Disease Control and its international outreach, including its China office. And if that office had been at full staff at the beginning of this epidemic, then it would have been not only getting better information, it would have been a specialist participant in the process. And whereas the CDC was not invited in to send teams in initially, Taiwan sent a team in, and that was allowed. And so it's not just a question of whether or not you let foreigners look. It's a question of the relationship between China and the U.S. at the time the epidemic started. Now that information, I think we should cut China a little slack on that. Think about the movie Jaws, okay? There you're dealing with something with much more definite symptoms, shark bite. There you're dealing with a democratic politics, but also dealing with the problem of adjusting your routine expectation of full beaches at 4th of July with a shark bite, if it can be explained by any other way, will save you a big headache. But it can't be explained any other way. But it took time. It took several bodies before the shark became the center of attention. And we all knew better because we were in the audience, okay? And we all know better about China in December, January, because we've seen what has happened since then. But I'm not sure if I would want to be the Wuhan official in charge of canceling all the meetings and all the celebrations of New Year's, et cetera, at that initial stage. The other thing is again, the problem of compatibility of data. France has over 500 deaths in nursing homes. Those aren't counted in the French deaths from coronavirus because they're not in hospital, and that's all France is counting is deaths in hospital. But the region that's hardest hit doesn't have very many hospital beds. So just like the restriction on tests that Anne mentioned, you have restriction on hospital beds in this case. So in each case, the particular criteria has to be considered for the statistics. China's not, there's not millions of dead bodies piling up in other provinces that no one has noticed in those provinces and no one can report on. The things don't happen that way in China.
And do you want to talk about misinformation, disinformation coming out of China?
Yeah, so this has actually been a really interesting story over the past several months. We've seen Chinese cyber actors actually shifting the ways in which they're engaging with disease information, much more closely mirroring Russian actors in that they're participating in social media discourse in the US. A lot of the discussions in mid-March, Zhao Lijian, from the Ministry of Information, asserted that this was a Chinese military hoax or a U.S. military hoax, and that China was being poisoned by the U.S. This type of kind of very assertive misinformation is much more in line with Putin and with the Russian information landscape. Now, the heartening part is we actually saw Chinese officials distance themselves, other Chinese officials distance themselves from Zhao Lijian, like Cui Tiankai, the Chinese ambassador to the US, stepped back from Zhao's remarks. So we are seeing a little bit of distancing, but that type of commentary is very worrisome when we see that emerging from China in a time like this. We're also seeing cybersecurity attacks on the very platforms that we're using right now to be able to communicate. So Bill alluded in his beginning remarks to Zoom servers in China and the movement of sensitive or non-sensitive meetings from the US to servers in China with very little kind of information being shared with users. But we also saw kind of from a more military standpoint that a group called APT, or Advanced Persistent Threat 41, was exploiting networking platforms like Citrix during and this was reported by the cybersecurity firm FireEye. Citrix, you may remember from the investments of Senator Kelly Loeffler, who made several big investments and several big sales immediately after a coronavirus briefing in January. So it's a networked communications platform. So we are seeing also Chinese cyber attacks on those platforms. So this is a new type of vulnerability when we move all of our communications online to platforms that are not necessarily designed for that, for people who aren't accustomed to adjusting their security settings or managing how they use platforms. This becomes a huge issue. So platforms like Zoom, unless you get a certain version, aren't end-to-end encrypted. So we're creating a whole new landscape of potential cybersecurity actions as we're speaking, even right now. So great to be here.
And Anne, as we're speaking, we couldn't be speaking in China or Taiwan right now, because one of my former students just emailed me and told me that that Zoom has been canceled in China and in Taiwan.
Yes, but that's a pretty recent phenomenon up until
today.
So that's interesting. The fact that Zoom, in some ways, I think it's a good marketing move for Zoom to be canceled in China and Taiwan, because the fact that it was still operating when nothing else was brought a lot of question marks.
Okay.
Let me ask you about internal management of information within China as it relates to political unrest. I think Brantly at the outset, and maybe Anne did as well, mentioned that at first Xi Jinping's initial reaction was a little rocky, and as a result, his domestic political support, particularly with the shutdown of economic growth. It's not just President Trump that's worried about it. I'm sure that Xi Jinping is. Economic growth numbers in China are watched from the outside because they can often lead to political unrest, local riots, and the like. And I'm just curious if in the United States we're looking at the beginning of a potential recession driven by the shutting down of internal businesses. In China, that's doubly the case, because while China has done that as well, they're also an export company. If we're all shutting down on the consumption side abroad, will that affect China, and what will the political consequences of that be? And therefore, the managing of information internally in China, therefore, becomes more sensitive. Would you both talk about that a little bit?
And not just managing information, but managing the economy, not just information about it. And that seems like a very reasonable question to raise, because to a great extent, people have explained the continuing role of the party and Xi Jinping too, on the basis of what they call performance legitimacy, because they've done well in the reform era. People support them. Well, if the economy goes negative and sharply negative, and then maybe makes a little bit of a recovery, but certainly not back up to 6% for the year or anything like that. This year is certainly not going to be like last year. And does it lose legitimacy? I don't think so. First of all, I think all the provinces except for Hubei province, the province that Wuhan is located in, are going to be looking at Hubei and thinking, thank God that didn't happen here, or didn't happen yet here. And well, let's prevent it from happening, and let's do what we can. So they're going to be looking at the abyss and judging positively movements, avoiding the abyss themselves and moving up a little bit. If they reach 4% growth this year, that would be pretty impressive over the whole year. So instead of thinking in terms of how is our economy compared to the economy before the crisis, is how well did our system deal with the crisis, and with recovery from the crisis. And we don't know the answer to that yet, but so far the movement seems to be positive. And so I think that's likely to strengthen Xi Jinping's prestige and strengthen the prestige of the party. When I was in China for SARS, people who had been skeptical about this continuing role of the party in China were less skeptical because of all the local level coordinated organization that the party managed. And they saw that as contributing to the management of the crisis.
If Brantly, if I could ask you a follow-up and then go to Aynne on that. John Brandon from the Asian Foundation in Washington asked the question of whether the pandemic might help improve emergency preparedness, food safety, as well as spending on healthcare in China. And given the SARS experience and what happened after that, do you imagine this? Another questioner had asked about whether China will shut down, limit their wet markets. Talk about that and tell me a little bit more about that, and then going to Aynne on the broader set of questions as well as that question.
Well, hello, John. And John is an expert on this type of practical policy development in all of East Asia, not just China. And he knows that since SARS, China has taken this type of epidemic prevention, taken the problem of epidemic prevention much more seriously than it did before. And as problematic as the treatment of the initial stages of this epidemic have been, they're much less problematic than the first few months of SARS. So there has been progress, and I'm sure that progress will continue. And there's already been a public ban on wild animal markets. So if it's the pangolins rather than the bats directly that are the problem, then I think there's going to be progress. If you identify a problem in China, to the Chinese government, and it accepts that identification, it's pretty strong-armed and it's pretty strong-minded toward handling that problem. The problem is, in most modern complex societies, problems aren't that simple, but maybe epidemics, maybe pandemics can be considered that simple.
So just building on what Brantly was mentioning, I think like we have seen a kind of progressive improvement in the pandemic response. So I was in China at SARS, and then as well during the H1N1. And there have been progressive improvements. This whole idea of, temperature checks and temperature check stations and the governance in individual communities. That's something that evolved during the SARS process, or during the SARS epidemic, and then was kind of further refined during H1N1. And then we see lots of very kind of sophisticated neighborhood evaluation processes combined with surveillance technology. Getting back to this economic question though, I think this year, if I were Xi Jinping, I would be less concerned about 2020 and 2021, as people are still in many ways reeling and grieving. So just trying to get back to the basics of their daily lives. I'm much more interested in what's going to happen in 2022, 2023, 2024, when there's a situation where people maybe won't have such, visceral memories of this time, but are trying to still, build their economic livelihoods back up. And I think that will be a really interesting test, not just for Xi Jinping, but also for the US economy as well. There was an excellent Miller Center panel on the economy and COVID-19 that I would direct everyone to check out. And the experts there highlighted that the recovery globally could take between 18 months and 10 years. So it'll be really interesting to see which of those we see and how that affects legitimacy both in China and the US.
That's a great segue back to a broader set of global questions. And I'd love to hear you both talk about China's view of international organizations in the management of this. There's been a lot of attention on the role of the WHO because of the WHO not including Taiwan, its own assessment of the data coming out of China, and essentially being obeisant to the Chinese, as it were. but more broadly, how you see this affecting how China plays in international organizations. There's a lot of speculation that China is going to come out of this stronger. Will seek, because of the United States' initial reaction to try to demonize China, will now seek to establish a number of bilateral relationships with former American partners like Japan, South Korea, and others. Or do you think that there's going to be a limit to that, both to the extent that those countries trust China, or that China really feels competent or confident to establish those kinds of ties?
Brantly, I know you've done a lot of work on regional organizations. I'd love to hear your perspective on this.
Well, the regional organization I'm most familiar with is the Association of Southeast Asian Nations in Southeast Asia, though I was also recently in Finland and Russia. But the basic, I think that if China continues its successful management of the COVID problem, then other countries will look to it not only for the manufacture, the supplies that frees up to distribute to other countries, and not only the experience, but also here is successful global country. China, as Bill mentioned at the beginning, China's status as global power was implicit in the fact that it could affect the global economy and global society the way it has with the virus. Now, if it can affect it in its recovery, that's going to certainly strengthen China's relationships. I do think it's going to be more soft power and more intangible. It's not like Japan is going to give up the alliance with the United States. It's that Japan's view of the United States is going to deteriorate if it cannot get masks from the United States, and it can get masks from China. And so the prestige and prospects and things like that will be affected. And maybe a good, to go back to regional organizations, in the 1997 financial crisis in Southeast Asia, in Asia, the Asian financial crisis of 1997, the Washington Consensus and Washington in general was not very helpful to Southeast Asia. China, for its own reasons, held fast to the value of the renminbi. And this helped stabilize the currencies of the other countries, which were going into free fall during 1997. And this action by China, which was self-interested, but also in conjunction with the interests of the countries of Southeast Asia, gave China a new prestige. And it used that prestige to go into the golden decade of China-Southeast Asia relationships from 1998 to 2008. So this is an opportunity for China. Now, Xi Jinping can mess it up. Xi Jinping can act arrogantly, he could act aggressively, he could act selfishly. All of those things will diminish what he can do. But so far, he's not doing things like what we've been doing with Canada and having disputes on whether we should send them medical equipment when they're providing medical equipment to us. Anne?
Yeah, I just want to, I know that we're running toward the end of our time, but one thing that I do want to note is that in some ways, I think that we can see the WHO's response to China as the culmination of a multi-year strategy to put Chinese government and corporate representatives into major international organizations. So we definitely see that with the WHO, and that was kind of the source of a lot of the criticism of the WHO's response to China's handling, especially in the earlier months when it was much more shaky. But we see that also in other organizations like the United Nations ITU, the International Telecommunications Union, in 5G infrastructure and regulations for what those standards should be. So this is a wide scale process, a wide ranging process, and in some ways, rather than something new, I think that we're really seeing the culmination of a long-term, very diligent strategy to influence international standard setting.
Well, we have come up at the end of the hour, and I'm so super appreciative of both of you spending the time with us as well as our audience. A final lightning round of question as you look forward to the future. What are you looking for? What should we look for from your perspective in the U.S.-China relationship as this crisis continues?
So I'm going to end on a very hopeful note. So it's a tough time, so we may as well take a hopeful note. I'm going to hope that what this means is that this kind of shared experience of suffering in COVID-19 means that the people-to-people diplomacy that we've seen kind of eroding over the past few years between the U.S. and China is able to kind of come back as we realize that we're all kind of dealing with a similar shared struggle. I don't know that I don't have evidence that will definitely happen, but that's my hope for the future.
And let me just build on Anne's optimism too. Basically, just like our personal experience with this pandemic is something that gets us away from, marginal gains here and marginal gains there and little tasks here and little tasks there to what counts in life, and what counts about keeping alive. And when these basic issues come up, I hope that it puts a better perspective, a more reasonable perspective on trade imbalances and intellectual property disputes. It doesn't solve the disputes, but it puts them in a broader human perspective. And that's a perspective that we should try to keep as things move beyond the crisis.
Well, I'm so appreciative of you both, Anne, in particular to that comment. It reminds me of something that I had totally forgotten, which is in the last week when I was living in China 8 years ago now, my research assistant and intern from that period, who was Chinese born but studied here in the United States, is living in the United States. She reached out to me last week, sent pictures of her and her delightful daughter and husband, and then offered to reach back into China if we needed any masks that she could find for us. And so I'm going to remember that hopeful note as we enter a rough and tumble election year. As a note for everyone watching today, if you enjoyed today's program, on May the 4th, we're going to be convening a 3-hour program on U.S.-China relations featuring a number of very senior former government officials, current and former government officials, as well as some of our experts. We'll be announcing details of that in the coming days. And I want to thank you all and our terrific event and technical team that have helped put this event together. And we're so appreciative of all the support our audience has given to us over the years. And we hope you'll keep coming back. So thank you.
Thank you.